Finding problems? That's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. Now on Talking Solutions, Chuck Ramey, Chief of Public Affairs for the VA's Southern Nevada Healthcare System, and Tim Jobin, the Chief of Mental Health. Welcome, gentlemen.
Thanks, Terry, for having us.
We always love having you in, and we have so many wonderful active and retired military individuals, both male and female, here in Southern Nevada. During September, we're very sensitive to the fact that it is Suicide Prevention Month, and we also wanted to address the issue of veteran suicide and see what we can do to help. Chuck, what's been going on with the VA?
Well, I think here in Southern Nevada, our VA continues to grow. We've grown about another 4%. We're going to probably surpass about 63,000 unique veterans that we're serving at our VA this year. We're going to surpass 900,000 outpatient appointments. That is good news. As we continue to grow, we are also continuing to grow our staff. So we have increased our staff size. It's amazing. There's places within our hospital that are growing quite a bit. As you remember, 5 years ago, there was no VA hospital here.
Oh, yeah.
Now there's a VA hospital here, and we're kind of getting to that point where we're norming. So even though we're growing and we're seeing continued access to our services, we have processes, procedures, staffing in place to actually address those needs. Growth is a good problem to have. We're still one of the top 10 growing VAs in the nation, but we are still balancing that with our ability to meet those patients' needs. Places like our emergency department, for example, they've seen about a 25% growth in the number of people who access those services over the past 2 years, but they've actually brought down their door-to-triage and door-to-doctor time to about 16 minutes for a veteran to come in, and we have them out in about 2 hours. So our days of waiting to get in for like primary care or specialty care appointments, we still have some places where we do need to do some work trying to recruit and retain like the rest of the community in those positions. But overall, we are seeing our specialty care, our behavioral health, our primary care times come down greatly as we continue to recruit and expand services and implement more technology such as telehealth into our processes as well. So there's lots of good things going on with the VA here in Southern Nevada.
You are so right, Chuck Ramey. It hasn't been that many years since all the news we were hearing about the VA was just terrible, long waits, veterans even dying waiting for appointments, and that is not the case anymore. It's so much better.
Right. It's improved tremendously, but like we said, healthcare is a local thing. So Nevada, unfortunately, ranks 47th in the nation for physicians per capita to the local population. We're 48th for nurses and unfortunately 50th for behavioral health specialists. So we have a big challenge ahead of us as we try to get our veterans the care they need. So we have to recruit and retain against that. We're hoping UNLV's new medical school will help us get some more of those doctors to stay here and grow that base as we go forward. But it is a challenge for us, not only at the VA, but it's a community challenge, and we're meeting those needs of veterans every day. Now, granted, there might be some other VAs or some other places in the nation that might get a veteran in a day or two faster, but they don't have some of those challenges that we find with our community that we have here.
Well, when you start at the bottom of the pack, like you referred to, there's no place to go but up. It's only going to get better, and it already has gotten tremendously better with things like the new VA hospital in North Las Vegas. Like you said, 5 years ago it wasn't here. Now it is a part of our healthcare system for our veterans. And I know that when we have you in, Chuck Ramey, and we talk about the Southern Nevada VA healthcare system, it's always important to put out there to both active and retired military what is available for them in the way of services, because even though your numbers have gone up, there's still a lot of people out there who could access the services you have available.
That is correct. There are approximately 100,000 veterans or more in this valley that are eligible to access our services. We have about 80,000 enrolled. Of those 80,000 are enrolled, and like I said, a little over 62,000 are using our services now. About 76% of the people who are enrolled in VA healthcare here in Southern Nevada are actually using our services, which is extremely high. The rest of the nation, you might see an average of about 40%. So you build it, they will come, and we have a large variety of services out there, everything from recreational therapy, and I'll let Tim talk about the behavioral health services, but primary care, specialty care, lots of different things going on. And then when we can't provide a service, obviously we're working with our community partners to provide those services, and we've done a lot of public-private partnerships. And as we talk suicide prevention today, we'll talk a little bit about that to help not only our veterans, but help the family members and others who need to get connected to those services find what they need as well.
This is a perfect time, Chuck, to bring Tim Jobin into the conversation, the Chief of Mental Health. As we have mentioned, September is Suicide Suicide Prevention Month, we also want to be especially sensitive to the fact that suicides with veterans is a very real possibility. I was talking with Goodwill. They've got a lot of veteran emphasis with their services. They were just saying the other day that the veteran suicide numbers for Southern Nevada are actually a little higher than the national average. So very much an issue here. It's the sort of thing you deal with all the time.
Yes, no question. One thing that I actually found was really interesting, a recent study that came out actually showed we were one of the few states that actually had a decrease in veteran suicide. We're still very, very high, though. There's no question, and a lot of work to be done. One thing that we've really focused on, and we've got a lot of support from our leadership, is we have added a ton of access and staff in our behavioral health programs here in the Southern Nevada healthcare system. We've about doubled our psychiatry service. Chuck mentioned how difficult it is to recruit behavioral healthcare providers, but we've had really good luck. We've had great partnership from the community. And many of our residents, as they come through, they want to stay to take care of veterans because it's such a great mission to get behind. We have same-day access for behavioral health in all of our clinics around the valley. So whether you're in Henderson, whether you're out in Centennial Hills, you can walk in and be seen that day for a behavioral health appointment. Also, I think one of the key things when we look at suicide prevention is to help individuals find meaning in their life. So we've added some work therapy programs to help veterans get plugged back in and to find that meaning that they had in the military. A lot of partnership with our community providers surrounding that too, because that's so important. One thing, when we look at suicide prevention, well, the VA plays a major role in it. It's not just a VA issue. It is a public health issue that everybody has to be on board with. It's very similar to smoking in some ways. You know, when we reduce the smoking rate, there's a lot of advertising. Everybody took it very seriously. And that's the same way with suicide prevention and decreasing our veteran suicide. If we all work together on this, private employers, the public sector, the state, families, churches, even some of the gaming establishments, everything like that in town. If we really take this seriously, we know how to advertise around it and how to get veterans connected to the care they need, we can tackle this. It's a public health crisis that we can actually really, really make a huge impact on. So it's exciting for us to have these services in place to get the veterans the care they need here in the Southern Nevada area.
And it's not just a veteran issue. This is a community issue.
Right.
Where all of us, as I say often, need to wrap our arms around those veterans and make sure that they get what they need. In the conversation with Goodwill recently, they were saying from their perspective, they see that having a job makes a big difference from the perspective of Veterans Village, different groups, U.S. vets.
Yes.
To make the homelessness for veterans not be such an issue, there are so many different ways we can help. And certainly the mental health area.
No question. The mental health is huge for veterans. We have to have those services out there for them when they're ready to seek care. And that's why the importance of same-day access is such a huge, huge component in suicide prevention. When it comes to mental health issues, whether it's substance use, whether it's depression, anything like that, when somebody reaches out, we've got to be there ready to provide that care. And I think when we look at our Veterans Crisis Line service, it's the biggest call center in the nation for crisis issues. They handle millions of calls per year, and they do it so succinctly and so quickly. And then they connect them to one of our local suicide prevention coordinators who works with veterans and gets them connected to care. When we see veterans that have had good success, they get a lot of follow-up care. So when they're expressing those concerns, reaching out to them, contacting them, getting them plugged into care, getting them plugged into like evidence-based practices, doing suicide safety plans with them, doing the full risk assessment, those are the things that really get them the tools that they need to get better. And then getting them plugged into evidence-based therapies that maybe surround the post-traumatic stress disorder that they've experienced or the substance use issues that they're having right now. Those are the things that really make a strong impact. And having people in your local community know about the warning signs for suicide prevention.
That's so important.
It is. It's a scary thing to talk about. And people worry sometimes that if they talk about it, that it's going to make it worse. But it's actually the opposite of that.
Yes.
When you talk about it, when you make it a norm, when you let people know that I understand you're going through a tough time, I'm going to show you compassion, but I'm here for you and we can get through that. And there's services out there that you can access. People can actually get better from this. So that's just key with suicide prevention.
A lot of people are afraid to use the word suicide.
Yes.
In talking with someone who might actually be leaning in that direction.
Right.
But what we find out is that it's a very important thing to bring up. It's okay to say to someone, have you ever considered suicide?
Yes.
Because by saying that, you're not putting the idea in their heads. It doesn't work that way.
Exactly. That is a great, great point. And so many people worry about that.
Yeah.
But it's actually the opposite it. You're reducing that stigma. You're making it easier to talk about. So coupling that with knowing the signs of some of the suicidal thinking that can come about, if you see people that are sad or depressed and it's constant, sometimes people go through episodic times, but if it's constant, that's something to really be on the lookout for. If you see people that are anxious or agitated, having trouble sleeping, maybe neglecting their personal welfare, you start to see where they're not functioning in the way that they were maybe functioning at one time. That's the time, and Chuck and I were talking about this on the card today. It's so important to get people plugged in when you start to just see those initial signs. That's the time to get them plugged into the VA. Lots of times people wait for the crisis, but if you can get it early on, we can start working with the veterans and get them moved in. The other thing that the administration's done recently, which I find is powerful, is they've allowed other than honorable discharges to get care at the VA for mental health care. So not dishonorable, but other than honorable right now. So veterans that maybe had something come up in service, some type of mental health issue that led to their discharge, in the past they couldn't come in and get the care that they needed. It's time limited, but they can still get that care where they can get plugged into the VA, get stabilized on medication, or get some of that therapy to help them get over that initial bump. But then we usually plug them into a private agency after that.
Well, there's any number of reasons why someone might leave military service under less than the best of circumstances. I had a relative who had been part of the Iraq conflict. He went into it never having a drink, going through it, dealing with things like IEDs and all of the things that are involved with military service. For this young kid of 19,
yes,
he came back with a real drinking problem.
Yes.
His departure from the service was less than stellar.
Right.
But I think I understand why.
Exactly. That is a great point. Having these services available to them when they come back. One thing that we've really worked on over the last year, I'm glad you brought that up, our substance use programs. We have an intensive outpatient program. It's 3 hours a day, plus there's individual counseling on top of it. Many times veterans are hesitant to engage in group therapy at first, but once they get there, in the military, we were all really raised in groups. The first day you hit basic training, you're in a group, you're working together to get by it, so that we find that they actually have better outcomes when we have really strong group psychotherapy. So we have that for veterans that are struggling with substance use issues right now. And then on top of that, we have that individual therapy component too. So that's every day, same day access in our substance use clinic. So you can walk in and be seen Monday through Friday, and we will get you plugged in and get you taken care of.
It's like the whole band of brothers approach.
Exactly.
You are part of a unit when you are active, and then when you're away from it, you still have that group bonding that is such a big part of the military.
Yes, that's exactly right. The other thing about addiction and mental health is it ends up becoming like a secretive thing. You kind of keep it to yourself, you hide it. That actually just makes people sicker. And so getting out there, talking about it in a safe environment with people that know what you're going through, that can help you work through it, that are trained, or just experiencing the same thing as you and have maybe overcome it, that makes a huge, huge difference with mental health. It strips away that secretiveness, which actually makes the disease so much harder to deal with.
That's that stigma. We need to have the stigma removed. We deal with that in so many areas.
Yep.
And certainly veterans and the problems that they experience, especially after their military service, their active role ends. There are issues out there. We're talking with Tim Jobin, Chief of Mental Health for the VA's Southern Nevada Healthcare System. Tim, mental health services, is it also available to the military family?
We are actually expanding some of that right now. So if veterans are enrolled in our caregiver support program, their spouses can get mental health care through us too. We've really added a huge slew of capability for couples counseling. And then this year, we're working on hiring a family services coordinator. Under that, we'll have our intimate partner violence program so that we can help families recover from issues like that can usually stem from substance use or mental health issues. Like I said, we have a lot of couples counseling, and our couples counseling is actually evidence-based. So we know that it actually has the capability to help people get better. And then we're looking at doing some parenting classes too. We have our NAMI family-to-family partner with a community organization on that, but that's also very impactful for families that are dealing with mental illness. A huge part of that is just having other people around you that understand what you're going through, that have been there, and that can help you do it. So no question that there's those family components that make a big difference. Chuck, did I miss anything on that?
No, I think that's very valid points. As you said, it takes a band of brothers, but I think it also takes a village to get at this too. So
Yes.
the VA can't do it alone. It's a public-private partnership, as Tim talked about. And Las Vegas, because of how we are with veterans issues and military issues in this community, we're kind of looked upon as a national leader in helping tackle some of these types of things. We were one of the first cities that was approached to help end veterans homelessness we could as part of the 25 Cities initiative. And we reached functional zero. We were the second city in the nation to do that, where any veteran who wanted a place to stay could have a place to stay. So they looked at us again when it came to this suicide prevention issue. And we are one of the 8 cities in the nation that was selected for the mayor's Mayor's Challenge, a private partnership between us, the VA, and the communities, and it's really run by the communities to get at the suicide prevention issues. So Las Vegas was selected as the lead city for that under Mayor Carolyn Goodman, but Councilman Steve Soroka is kind of leading that effort on her behalf. And what he has done, and the city through their various agencies, they've brought together a group of people, the VA, but also people from the state, people from the city agencies, as well as the nonprofits, to discuss suicide prevention and to work as a team to help provide those resources, obviously for the veterans, but also for the families as well. As Tim talked about, there are a lot of things that lead to that crisis situation, but if we can get at those things earlier, we can address them. And that's where we're working to kind of build this public-private partnership to put those resources in place, especially for families. They are really working on postvention right now. Obviously, we don't want to see a person take their lives. Unfortunately, it does happen, but what happens to the families and the loved ones who are left behind? They're working on some programs to try and help those types of families out. They're also working on some things. If you're a service provider and you deal with this type of issue, how do we help those people recover from a tragic situation such as that? So there's a lot of issues that our city is taking up under the Mayor's Challenge. And when I say it's a city and Las Vegas is leading it, Mayor Goodman is quick to point out that this is a Southern Nevada effort. So
Absolutely.
She has pulled in the mayors from everywhere from Boulder City to Mesquite to North Las Vegas, Henderson, Clark County Commission. They're all pulled in. So this is a team approach to get at this issue and work at that. And I think that's where a lot of those family things will be worked as well. And it's not only just working the suicide, but as part of the Veterans Community Engagement Board, which we have partnered out at the VA as well, we look at things like transition and getting veterans connected to care as quickly as they can when they come out of the service is one of those things that will help. We don't want to be connecting them to care when they're in crisis. If we can connect them to care sooner and get them connected to either that health care, the mental health resources, other resources that may help them with social work, those other things, then hopefully we can address some of these issues before they even become a crisis situation.
We're talking with Chuck Ramey, the Chief of Public Affairs for the VA Southern Nevada Healthcare System. Also with us, Tim Jobin, the Chief of Mental Health. It is Suicide Prevention Month. We're also addressing, certainly, military suicides. One of the things that you brought up a moment ago, Chuck, about the Mayor's Challenge. I'm excited about that. I know Mayor Carolyn Goodman and all of the mayors of Southern Nevada. You mentioned also Councilman Steve Soroka, and I know he is retired military.
He is.
So he understands some of the difficulties very commonly experienced by someone who is retired military.
He does. Councilman Soroka is involved in a variety of issues in our community. I actually served with him while I was in the Air Force, and he is a real good guy who has his heart in the right place to address a lot of these issues. So he takes this personally, and he's taken this on behalf of the mayor and the city to lead this effort. But they have a good group of people, experts from all walks of the city, as well as the county and the state, including the state suicide prevention coordinator and several others who are looking at this with a holistic approach and wraparound approach to try and get veterans and their families and caregivers connected to services.
You mentioned, Chuck, about taking it personally. I think everyone in Southern Nevada, military or not, should take this personally. These veterans put it all on the line to protect and guard our freedoms. We owe them everything. This is part of healing our community.
I think it is a part of healing our community. And sometimes, like Tim said, it's that how are you doing, or having that conversation, just letting people know you care, and also making sure that we let people know that there are resources out there that can help these veterans. The most disturbing statistics I think we find is that of the 20 estimated veterans we lose a day, and it depends on which way you look at the survey, but at least 13 of them are not connected to the VA, to VA care and services. Now, they've gone back and are re-looking at some of those suicide statistics to figure out and separate the military from the veterans. That might change those numbers a little bit, but roughly 2/3 of those individuals are not connected to VA care. And then you find when veterans do get VA care, particularly female veterans, that their chances or likelihood of them taking their life drastically decreases.
That's the biggest piece of the puzzle. If we can just make sure veterans are connected to the VA system and all of the things that are offered, that could be the key.
Most definitely. I think that could be the key, as well as just letting people know that you're there for them, that you care, and you're there to help them through whatever that difficulty may be. And if we can connect them, it might be connecting them to housing or to mental health services, recreational therapy program, pain management. It doesn't matter what it is. If we can work the little issues up front, the bigger issues may not occur later. And I think that's what we're all trying to do here as part of the VA, is be part of that public-private partnership and that community approach of working the veterans issue issues up front and as early as we can from when they separate from service to alleviate any of these issues down the road.
And let our veterans know how important they are and that each and every one of them matters to our community. We have our Talking Solutions Facebook page. We always put links and information, plus a podcast of our discussion today. The Veterans Suicide Prevention Hotline, we will offer that as well. Tim Jobin is also with us, the Chief of Mental Health. Being that it is Suicide Prevention Month, we're also highlighting the veterans' suicide problem and how we all need to be a factor in fixing this. Those of us who are not military, what can we do? You mentioned the signs that we want to watch for to help prevent suicide, that we don't want it to get to a critical situation, sure. That mentioning the word suicide, it's okay. Yeah. It's not like it hasn't occurred to them. You're not putting the idea in their heads. But what can we do from our end to help make this better?
That's a great question. I'm so glad you brought it up. I think when you take that stigma out of it and you start talking about it, I've seen this personally working with veterans in individual therapy. You just see that relief when they're finally able to open up about it. Some people really want to see an individual therapist or that professional mental health counselor to talk about it. Sometimes people just need their local supports to do that too, whether it's clergy at their church. I've had veterans say, I appreciated this, but I also get a lot of great support from my church, and that's where I want to be able to talk about it, or I want to get a lot of great support. We've got a very tight family system. Taking away that stigma, I think it's scary for the people that are talking about suicide to even mention it, but it's so important to just have that level of comfort where it's mental health just like physical health. It's no different than going in and getting a checkup for your diabetes. It should be on the same level as that. And when you need to go in and get care around mental health, same thing, and so important to talk about. I think another big thing is just having the resources out there. So the more that community agencies want to do and post the crisis line and get the word out there, reach out to us. We will work with you to get that put up on your websites. I drive around and I look at the different entertainment establishments in town. The more that we can get the word out around that stuff. And when people see that, when they're going through that tough time, because you never know when they're out and about and that thought may hit. And then they look up and they see that contact for the crisis line number. VA slogan is kind of hashtag be there right now. It's all about being there, having those resources available, getting that advertisement out that these services are out here. You're not alone. There's lots of other people going through this, and that recovery is possible. People don't always realize that mental health recovery, substance use recovery. Las Vegas has a huge recovering population. It's the home of Gamblers Anonymous, a huge 12-step support group in this community, and a lot of great people working in the mental health fields here and with our partners in the state. Recovery is possible, but it's all about letting people know that it's okay to talk about these issues and that resources are there. So the more that people can help with getting the word out, the more impactful it is.
We really can make a difference, and removing that stigma is key. We mentioned earlier Southern Nevada when it comes to physicians per capita, nurses per capita, where we rank in mental health services. We're down at the bottom of the barrel. We're not going to sugarcoat it, but it's getting better. And with every individual that we can save from suicide or some terrible situation, it makes a difference.
Yes. And as you bring that up, one of the other great things that people in this community would have access to, and that the VA does really well, is they're really using technology to reach veterans. They have apps now that are proven to help with post-traumatic stress disorder, tobacco cessation, substance use issues, but getting plugged into that. Also, some really cool stuff. We're actually doing counseling right into people's homes. We could do a counseling session right on your smartphone.
Like a teledoc.
Exactly. In the past, we would beam out to like Laughlin or Pahrump or one of our other agencies, but you'd have to come into the clinic. Now we've got it where we can beam right into your house and do that. So if you have childcare issues or something like that, the VA is really working hard. The other thing, I'm so glad you guys brought up our women veterans, such an important part of our population. They make up about 9% of the veterans that we serve at the VA Southern Nevada healthcare system, but we have a great women's health clinic, safe environment. Only women veterans get their care there, and we've added a ton of mental health services. We have a peer support specialist who's another female veteran that can really relate on that level. They've been through recovery, and they've dealt with some of the specific issues that women veterans face. We've added mental health prescribing services. You can go up there and see a really qualified if you do want to try medications. And then we have a lot of counseling up there right now to include group therapy and individual therapy for our female veterans. And it's all in that Women's Health Center.
A lot of great options for people who need help. Chuck Ramey is also talking with us, the Chief of Public Affairs for the VA Southern Nevada healthcare system. You were mentioning a little bit earlier about how many veterans there are in Southern Nevada who have not yet taken advantage of the services that are available.
Right. These statistics, I don't rely on them 100% because I feel like we have more veterans here, but they estimate around 145,000 veterans here in Southern Nevada. Nevada. I personally think it's a little higher. And of those, they estimate around 105,000 are probably eligible for VA health care. And of that, we have 80,000 enrolled right now. We've gone up quite a bit in recent years, but we have more room for people to enroll in that care and those services. And all a veteran needs to do is either visit our VA Medical Center in North Las Vegas or one of our facilities out in either Henderson or here in the southwestern part of Las Vegas or one of our other locations in Pahrump and Laughlin.
Oh, sure, the one at Buffalo and Warm Springs.
Exactly. So they don't have to come all the way out to the medical center in the north part of town. They can visit one of our primary care clinics, go in and talk to somebody about enrollment and see what their eligibility is for services and care. Information also available on a website? It is www.lasvegas.va.gov. All the information is on there as well. Nationally, the VA is also trying to launch a site, and they've got some of the activities on there now. It's called vets.gov, where they're looking to eventually move a lot of our information to make it more user-friendly for our veterans, because we find that a lot of our veterans, and people say it's the younger veterans, but we see some of this with the older veterans too. They like the technology. As Tim talked about, we have technology that goes right into people's homes now, but people are trying to take advantage of more of that internet-type technology, and the VA is trying to become more user-friendly as well. A couple things we've done recently, veterans can make their appointments online now for primary care, mental health, and some of our specialty care. We expand that. It seems like once a month, adding care to that. But one new thing we introduced recently is called Vet Text. So like any other service provider in the community now, when you're a veteran and you have an appointment coming up, if you have a mobile phone number on file with the VA, we actually send you a text to remind you of your appointment, and you can either confirm, yes, I'll be there for my appointment, or you can cancel that appointment. And that helps us out, because then if you cannot make that appointment for whatever reason, you're able to cancel it in real time with that technology, and we're able to free that appointment up for another veteran. So we're helping our whole veterans population there. But we continue to move forward with that technology, and we're hoping that by finding more innovative ways to reach our veterans population, that we can create more access for our veterans, and we can also make it more user-friendly for them as well. Makes the whole system work more smoothly.
You know, one of the things we do, Chuck, is ask as part of Talking Solutions, what can we do to help you?
I think the big thing, since it is Suicide Prevention Month, is help us get the word out.
We have our Talking Solutions Facebook page. We always put links and information. The Veterans Suicide Prevention Hotline, we will offer that as well.
There's two ways veterans or family members can access that. One is the Veterans Crisis Line number, 1-800-273-8255, or TALK. And that is actually the number to the National Suicide Hotline. But what you do is you press option 1 if you're a veteran. The other way is on the internet, veteranscrisisline.net, and that is the online link into the crisis line. And then there's also a text option.
That is 838-255. You can send a text, get connected with the Veterans Crisis Line, and somebody will respond back to you. And the importance is live, fast response. And with all three of those options, you're going to get that.
24/7. Mm-hmm. They are never alone.
Right.
Tim Jobin, Chief of Mental Health. I'm going to ask you the same question. Talking Solutions, what can we do to help you?
Once again, as Chuck said, it's Suicide Prevention Month. The more that everybody sees this as a public group effort that we can actually solve, getting the word out on reducing stigma and suicide prevention, that's so huge. So the more that people want to get involved, post the VA crisis line, get that number up different places. There's so many veterans here in town, as Chuck mentioned, over 100,000 in this area. Many of them work at different agencies around town. Getting the word out to your employees about this. Hey, the Veterans Crisis Line is here. Being aware of veterans issues. We have all those resources. We would love to send somebody out to share it with your employees. And making those services available makes a huge, huge difference for our veteran population.
Post it on Facebook, tweet it out, post it in the break room at work.
Yes.
We need to shine a light on it. As you mentioned, Tim, we need to remove the stigma. Mm-hmm. We need to all talk about this issue and save those veterans.
We all go through tough times. There's no question there. But letting people know they're not alone during those tough times, and there's resources out there that can help you get through. That's key to this crisis right now. And the more that we do that, the more that we accept it and don't fight it, share these resources with individuals and talk about it and support each other and really come together.
We're going to make those numbers go down and down and down, because one veteran suicide is one too many. The numbers that we have right now, totally unacceptable. But we as a community need to bond together to fix it, basically.
Yes. And I think Las Vegas could be a leader in this. There's just no reason why, with the Mayor's Challenge right now, with the hard work that our VA is doing, and with the support for veterans in this community. When we put the Fisher House out at the VA, it was amazing the way people came together to build that so quickly. There's no reason that we can't get the word out on the veteran services that are here, get this posted around town, get it up all over the place. We'd love for people to reach out to us through Chuck and share this information. for people that have fought for us and have worked to keep our country view, it's such a small thing to do. So we would love to work with our community partners on this and get the word out.
Tim, Chuck, speaking for Beasley Media Group, we are so thankful that you would come in and share this with us so that we can help raise awareness of September's Suicide Prevention Month and all of the VA services for health in general, and especially for the mental health services that are available that can help to cut down and get rid of this problem of veteran suicides. Links, all those details on our Talking Solutions Facebook page, along with the podcast of our discussion today. Chuck Ramey, the Chief of Public Affairs for the VA Southern Nevada Healthcare System, and Tim Jobin, Chief of Mental Health. Thank you both for joining us today on Talking Solutions.
Thank you.
Thanks for having us, Terry.
Talking Solutions is a production of the Community Relations Department here at Beasley Media Group, Las Vegas. Get more information on today's topic on our Talking Solutions page on Facebook, where you will also find links and a podcast of today's show. Thanks for listening, and have a great week.